Hello, everyone. Hello, everyone. My name is Lynn Labarda, and I'm the founder and CEO of iMark Billing. And we specialize in billing and coding and QA for the home health and hospice industry. And today I just wanted to do a 5-minute webinar just to give Medicare certified home health agencies a quick overview of the new no pay wrap requirements come January 1, 2021. So this is going to be really important for either existing agencies or newly certified agencies. It really doesn't matter. It's going to affect all of us, where we're going to have some penalties if wraps are not submitted within 5 calendar days. And that is going to be effective January 1, 2021. Medicare has been publishing information, new information and clarification every few days. So I just wanted to give you a 5-minute quick overview on what you need to know, what you need to start thinking about today in order to prepare for January 1, 2021. But I will do a much more in-depth webinar, very detailed on all of the requirements that you need to understand and all the changes that are going to affect Medicare certified home health agencies come January 1, 2021. So let's get into it. Again, it's a quick overview, and we're going to have a lot more detailed in the next webinar, so stay tuned. Thank you. So let's get into it. The no pay wraps for Medicare certified home health agencies. And this is going to be effective January 1, 2021. Like we said before, this is just going to be a brief overview. We will have a much more detailed webinar coming very soon. For now, what we need to know and some of the action steps that we need to take are, come January 2021, whether you're an existing agency or a newly certified agency, you will receive 0 monies upon wrap. Okay, so this is a big change for us. We will still need to bill the wraps. That's still going to be a requirement, but we are not going to get paid anything for those reps. So this is going to affect cash flow. So it's important to understand what processes need to come into place before January 2021. The wrap submission requirements have changed, and we're going to get into that now. Keep in mind that we still have to bill a wrap for the first 30-day period and for the second 30-day period. So we still need to do those. The requirements have changed a bit, and we're going to talk about that in a moment. There will be a 5-day penalty, meaning that the first 30-day period, a wrap needs to be billed within 5 calendar days from the start of care date, okay, in order for us not to receive a penalty. And we'll talk about that penalty in a second. Now, also, the second 30-day period wrap needs to be billed within 5 calendar days of day 31. So the good thing is that Medicare has allowed us and is going to be allowing us to bill the first 30-day period wrap and the second 30-day period wrap at the same time. So they're going to allow us to not have to have that second 30-day first billable visit completed. They're going to allow us to just bill both of those wraps upon start of care. So I think this is going to be really important, and we need to do that in order to not make a mistake and accidentally miss the deadline for the second 30-day wrap. Okay. The deadline is 5 calendar days. If we do not bill those 2 wraps within the deadline, what will happen is Medicare is going to deduct a daily rate from our final claim. So they will calculate how many days you were late, and they will deduct a daily rate from your final claim. So you need to be really careful, because it could be a significant money loss. So meeting that deadline is going to be critical come January 2021. So I think the trickiest thing is to understand the new requirements and what the new process is going to be. So let's talk about that. The new requirements to submit a wrap. So they've changed. First, Medicare says now that there's only going to be really 2 requirements in order to build a wrap. First, you have to have an order, verbal or written, which you're going to have. And second, the initial visit within the 60-day certification period must have been made and, of course, documented in your software. So, those are the only two requirements in order to get that wrap out. We don't have to have the plan of care submitted. We don't have to have for the second 30-day wrap, we don't have to have that visit completed either. So keep that in mind because we need to get those wraps out as soon as possible so we can meet the deadline. So let's talk about some of the action steps that I want you to think about now. First, start thinking that start of care visit needs to be done as soon as possible. The faster, the better. Second, think about your coding process. The coding needs to be completed as soon as possible so you can get that wrap, both of those wraps billed at the beginning. Okay. So part of the comments from Medicare is really that the primary diagnosis is the only thing that needs to be on that wrap. Okay. So the comorbidities, of course, are going to be in the software and they're going to be on your final claim. But in order to build a wrap and get it accepted, since we have this very short deadline, they're only requiring us to have the primary diagnoses. So you might want to have a process change when it comes to coding and consider getting the primary diagnosis coded, done first, so you can release that wrap. Now, I would contact your software. I think the software vendor is going to be really important here because you need to discuss with them what are their new updates and what are the new processes in the system in order to release the wraps as soon as possible. Because we don't, some of these softwares will have these hard stops that won't allow us to bill a wrap if, until the plan of care has been sent to the physician and there's all these dates and check marks and all kinds of things that, the softwares have in order to stop us from billing a wrap without the requirements. Well, since the requirements have changed to bill a wrap, you need to contact your software and see what they've done in the system in order to allow us to release those wraps as fast as possible, especially that second 30-day wrap, since we can bill the second 30-day wrap at the same time that we're billing the first 30-day wrap. You're going to need to talk to your software and figure out, what they've done in order to make that happen. So, like I said, we are going to have a much more detailed webinar with everything that you need to know. But for now, I just wanted to send this quick video out and just a quick bullet point and some action steps that you want to start thinking about now in order to implement this come January 1, 2021. So stay tuned and I will send you another webinar very soon. Thank you. If you have any questions, my email and phone number is on here. Thanks. Bye-bye.